What if, instead of paying for health services, we paid for healthier people? Value-based purchasing is changing the way providers care for patients by purchasing healthcare based on value and rewarding providers who work together with their communities to improve patients' mind and body. In a traditional payment structure, providers bill for services, regardless of patient outcome. With value-based purchasing, the state pays for healthier patients, not volume of services. Providers will be rewarded on quality of care and patient experience. This shift to patient-centered, evidence-based, whole-person care leads to better care, healthier communities, and lower costs. Washington is at the forefront of a national movement toward value-based purchasing. The Healthcare Authority is using its purchasing power to lead by example and to accelerate value-based purchasing. Washington has an agreement with the Centers for Medicare and Medicaid Services for a 5-year Medicaid transformation demonstration. This demonstration helps Washington continue changing the way it pays for and delivers Medicaid services throughout the state. The goal is that Washington's annual health care cost growth will be less than the national trend, and that nearly all health care payments are tied to quality and value, effectively purchasing more health for less. Payment is the key driver in how health care is delivered. The Healthcare Authority purchases care for over 2.2 million Washingtonians and manages more than $10 billion between employee health benefits and Apple Health, the state's Medicaid program, annually. As the largest purchaser of healthcare in Washington state, the HCA has committed to a value-based purchasing roadmap to transform the healthcare delivery system. The HCA is supporting providers in making the shift to delivering value-based care with resources like the Practice Transformation Support Hub, access to better data about their clients and their community, and regional collaboratives called Accountable Communities of Health. The HCA is helping providers apply a common set of best practices to treat patients, supporting the use of certified patient decision aids and tools to help people have conversations about their health, and meeting and tracking along common measures for quality care. Value-based purchasing rewards providers who control costs by focusing on better care. The result is lower healthcare costs. Paying for value means that patients receive the right amount of personalized care. Not too much, not too little. Personalized care helps prevent illness and manage complex health conditions, which means money can be spent in smarter ways for better outcomes. When providers coordinate with each other and prescribe the right amount of care, they're able to avoid extra costs from services the patient doesn't need. Through savings and avoided costs, VBP can save Washington State millions of dollars in the coming years. By aligning with the national movement and rewarding providers for improving patient health, value-based purchasing helps us achieve better care, healthier communities, and lower costs.